Medicine and sports, peak performance versus optimum health.
Most of what goes on in sport goes on off the playing field.
It's about what you have on them in order to protect yourself.
I was first raped violently.
Well, you're finished. You'll never play football again.
Obviously, shoe contracts worth $400,000 or $500,000.
Morals and ethics don't exist above and beyond the society that they're a part of.
Nowadays, kids are faced with the choice of do you want a couple of $1 million or your college degree?
Sport is a metaphor for what goes on in the real world.
Modern medicine plays an important role in sports. While some medical breakthroughs provide new ways to diagnose and repair the injured, other discoveries increase endurance and enhance athletic performance. Physicians are called upon to treat athletes with their best skills, but managerial and ethical conflicts can result in some doctors inflicting significant harm upon their patients. Who does the team physician work for? The athlete or the team? Should the athletes determine whether or not they should take risks with their health by continuing play, or does the team have a responsibility to prevent the player from potentially harming themselves? These are only a few of the questions which were discussed at the Summit on Sports Ethics. Let's revisit the summit and come face to face with difficult issues surrounding medicine and sport.
I deal with chronic pain every day. This is the longest trip I've been on in 3 years, because to travel for 3 days for somebody who's in chronic pain is like making a trip up the Amazon. And I don't think my case is particularly sad because I can write, but I do know literally hundreds of ball players who are locked away in little dark rooms trying to get through the day because they are so battered and beaten and are now reaching those years where there is no pension for guys who came before 1960. They're getting old and they're broken. And I'm angry about that because I'm a member of a union that has $600 million earmarked for that kind of help, and none of that money gets to injured players.
The other issue, which I hope we get into here, is the dilemma that team doctors, and Rob framed it beautifully in his book, face when you're dealing, and not only, I still look at that movie, North Dallas 40, 20 some odd years later, and I am frightened by what I see on that film. And I hope Pete talks about it. But the dilemma that the doctors face, and I just want to read one quick thing, and it didn't come from Rob, but it came from Lon Castle, who was the former president of the NFL Physicians Society, who dealt with this on a daily basis as Rob did. And just to preface it really quick, every player in the NFL has the contractual right to use any doctor he wants, a physician of his own choosing, and a second opinion of his own choosing paid for by the team. But those decisions are colored by loyalty and trust in both the team and the team doctor. And you talk about ethics, imagine the ethical dilemma that a team doctor faces and the moral dilemma a team doctor faces as he walks that razor-thin line between being paid by the team as a member of that team's front office physician staff and his medical Hippocratic oath, his responsibility to the patient lying on that table. And Lon Castle and Rob said it so well. The dilemma. I think it's a very unusual situation for a physician in the fact that you are essentially employed by an NFL team to take care of its employees, the NFL players, and your allegiance may be toward the NFL owner. But your allegiance must also be to the players, and sometimes there is a difficulty because the owners feel that a player no longer serves the purposes they need to perform on their team. And there's these very injuries and illnesses that you're taking care of, maybe the reasons to terminate the player. So it becomes a dilemma. Are you an advocate for the owner? Are you an advocate for the player? As a physician, you're always interested in taking care of the patient, and reality, the players are the patients that we care for. Well, I can sure Pete can tell you, and Rob steered me to one player, Kurt Marsh, who I'll talk about later, whose life was just totally devastated by his trust and belief in a team. And the last thing is not only this trust now between the teams and the doctors, but now it's become, in 2 cases in the NFL, we found out, the Jacksonville Jaguars and the Carolina Panthers, where they put their health care services up for bid just as they would to become the official beer company of the Carolina Panthers or the official tire sponsor of the Carolina Panthers. And I'll read you just one last thing, which I brought. It was from this went out to people that wanted to become the official health care providers of both of these teams, this little letter. The first seven of these things, all were medical. The last one, which is the one that pissed off a lot of people when I got my hands on it, was funds available to commit towards sponsorship of Panthers, in parentheses, suite, radio, television signage, program ads, etc. So you tell me as to whether they're putting their athletes' health care up for bid. I would suggest that they were.
I thought first the best thing to do from my case is to tell you who I am outside of the fact that I write books and occasionally do films. But most of the time I groan and lay around and bitch about my life. I've been in chronic pain for almost 30 years. I've got lumbar vertebrae damage, I've got thoracic vertebrae damage, I've got cervical vertebrae damage, I've had 3 knee operations, in which the third one was done under a local anesthetic.
When we went public with the Kurt Marr story, you know, a very unfortunate individual who I believe ended up after something like 15 surgeries losing his leg due to a horrible ankle injury that the nidus of which was playing hurt, basically getting numbing shots, taking the body's alarm system off, and then continuing to play. When that became known, all of a sudden, you know, players started becoming a little bit more aware. And, of course, everybody said, that doesn't happen anymore. Huizenga's full of it. That was back in the 80s. And all of a sudden it came out that an all-pro end from Denver was getting shots every week. Linemen from the Rams are getting shots every week to be able to play, sometimes to be able to practice during the week. So it still goes on, but now it's really going undercover, or it's being eliminated, but basically just because of bad press and legal issues.
The only way I found out that I'd fractured my thoracic vertebrae, I found out my lumbar vertebrae much later, was that the ambulance got me to the emergency room and they took the x-rays before the team physician got there, and the resident on duty said, well, you're finished. You'll never play football again. You've broken your back. You've knocked 3 short ribs completely off your spine, and it looks like you've crushed the muscle that runs down the left side of your spine, and I don't know that those nerves will ever recover, and 30 years later they never have. The next, within the next hour or so, the team doctor comes in and says, boy, you got a bad bruise there. You really do. You're going to be out for a couple of weeks. And, of course, you know, I believed him. I wanted to believe him. I wanted to play. And a lot of this responsibility comes back to me. I mean, nobody held a gun to my head and said I had to go out there. Nobody held a gun to my head and said the next week after I broke my back that I had to take 12 shots of Novocaine in the spine to try and play the next week against the Rams. That was my idea. I mean, they said, here's your alternatives. You can either not play, or we can, the muscle mass is awfully big, but we can try to inject it. And they used 12 syringes of xylocaine up and down my spine, and I made it through halfway through the warm-ups.
Well, obviously, nonsteroidal anti-inflammatories are used ubiquitously in sports, and when used appropriately, like all analgesics, they can be the right thing. Steroid shots in a joint can be great medicine. If you diagnose properly, give the cortisone shot, prescribe strict rest for a period of time, and keep the person out of sports, and then monitor them, and then don't give repeated uses of it. Or it can be the worst medicine, where you use any type of drug to inappropriately turn off the body's alarm system and send the kid back out. And that's where you need good physicians, and you need parents to take a little bit of an interest to make sure they're getting good physicians. I'm in a legal case right now where I'm reviewing a case for a major university where a kid had a tremendous bad back and really couldn't feel his legs, but it was a big game with Notre Dame. So they put the kid, he couldn't ride in the bus, they put him in a van laying down flat, and the doctor described to the parents, you know, it's okay, it's just a bruise, you'll be okay, and the parents go along with it. I mean, what kind of lunacy is this?
I have a broken right leg that they fixed the bone like this It's the small, and when I pointed that out, when I felt down there and this huge bone sticking out, and they got a screw through it, they said, "Don't worry, it's not a weight-bearing bone." So, it sticks out like this, and there's this huge lump in my leg. I have constant pain and very little flexion in the ankle. I don't know how many times I've been knocked out. I don't know what sort of brain damage causes me to behave this way, but I'm sure there's some. But ultimately, that led me almost immediately to the world of drugs.
Some sports, such as football, provide serious risk of injury and provide multiple cases where medicine and sports intersect and create ethical and managerial problems for doctors, athletes, and teams. Peter Gent presented his personal story where doctors misdiagnosed, misprescribed, misrepresented, and did what they could to help him keep playing, which was exactly what Pete wanted. Armin Katayan explores the conflicts which occur when the doctors bid for the contract to provide health services to the team. Do these business interests pose a threat to the proper delivery of medical care? Dr. Huizinga shares his personal experiences and professional conflicts as a team doctor. He shares how doctors can cause serious harm to athletes and to their own values by placing team values ahead of their duty to advocate for the health of the athlete. Managerial and ethical conflicts confronting physicians work their way out to other aspects of society. The media, the families, the legal system, and power of big business interests are all linked into difficult situations.
I like to criticize the TV networks. It's amazing. When my book, It's Just a Bruise came out, all the TV stations that carried the Raiders locally and the NFL football didn't want to do the coverage. It was the opposite stations that jumped on it. There's huge pressure there. I was up to be a sideline advisor, to do a medical analysis of games for Fox. They didn't want to touch me when it came down to it. They do not want somebody like me that might go on TV and say anything negative. You look at incredible sanitized versions of what happens in the NFL, and I'll just say one other thing. I was watching the playoff game last year. It was the Jets, Detroit, and there was a player that went down basically immobile, and he started having seizures. It was a guy in the Detroit team. And Phil Simms had the chutzpah to say, well, this is a terrible thing, it's a contact sport, but thank God the NFL does everything in its power to prevent injuries. I was so mortified, I had to turn TV off. And that's who they have on TV, with all due respect. That's what they want to hear. Matt Millen, great friend of mine, and he comes the closest to really saying something. But these other guys are so much Melba toast, it really makes me sick. Yeah, I got to come back and watch the Super Bowl because I love football. But it's amazing how you look at the TV networks and they just want cheerleaders on.
I'd never taken drugs until I got to professional football. By the time I was out of training camp, I was getting injected every day to make it through training camp because that was the year you couldn't go on a taxi squad. They'd move the rosters up to 40 men. If you didn't finish training camp, you didn't make the team. So they injected, I tore a hamstring muscle, and they injected the hamstring every day for practice for 10 days. And then for the game, and then, of course, had to continue to inject it mainly for the games the rest of the season. So I went from a tear that would have left maybe a piece of scar tissue this big, because scar tissue doesn't stretch, to by the time the season was over, a piece of scar tissue the size of my fist in my hamstring muscle. And that was my rookie year. So every year after that, I continued to tear around that hamstring. In 65, I started tearing my knees up. 66, I had a pretty good season, wasn't injured. 67, the first serious back injury was when I broke my lumbar vertebrae, and I'm laying on the field. The team doctors run out, and what happened was a guy speared me low in the back. I was on the ground with the ball, and I wasn't going to get up. I knew that was crazy. I was in the middle of the linebackers. They'd love for me to get up. I'm just waiting for somebody to come touch me on the helmet and say I'm down. And this linebacker jumped about 20 feet and buried both his knees in the small of my back and fractured the back and crushed all those nerves. And so I roll over, and my right leg's on fire, and my left leg is dead. I can't feel it at all. So the trainers and the team doctor come out, and they say, "What's the matter?" I said, "I can't feel my legs. I think I've broken my back." "No, you haven't broken your back." I said, "Look, I can't feel my leg. My right leg's on fire. My left leg, I can't move it." "Move your left leg." "I can't move it." "Move your left leg." Who's not listening here? Is it me or you? I can't move my left leg. So all they did was grab me. They just picked me up and dragged me off the field to the 20-yard line and laid me down and then left me there. Now, the bench was at the 50. It took me the rest of the first quarter and all of the second quarter to crawl back to the bench, where I got a couple of my teammates to take me in to the training room and call an ambulance, and that's when I beat them to the hospital, and the intern, or the resident, told me that I had broken my back. Years later, I found out that I'd stress fractured my thoracic vertebrae, having a standard chest X-ray for my lungs. These three vertebrae are just split down the middle like you split them with an axe. So are my cervical vertebrae. That comes from not having that patch on your helmet that says when you run into somebody head on, all that's doing is transferring all that pressure from your head to your neck to your spine.
Well, I think most of the drug use has gone underground. Obviously, growth hormone is endemic. Amphetamines are used quite liberally, but they're going underground. As compared to the 80s, where everybody got their amphetamine in the sock rolled up, when you got your jock and your socks given you, the various pills were rolled up in there. And, we had obviously the grab jar and things like that. Those have all been cleaned up. But there still are the guys with drugs. There still are very sharp steroid advisors. If I wanted to, I could get people on any drug. I know how to get people around any anabolic steroid testing program. It's not that big of a problem. The question is, are the guys smart enough to get the right advisors? And in most cases, the answer is no. So the NFL, to their credit, has done this random anabolic steroid testing. They've avoided the amphetamine issue. That doesn't play real well. No other leagues are looking into it. Look at boxing, huge problem. Look at hockey, baseball. They haven't even begun to do it. So we can't, push on the NFL too hard. At least they're talking about it.
When I wrote North Dallas 40, I was so used to that the book I was writing was about this guy trying to have a love affair in the midst of all this. I didn't think I was exposing anything. I mean, when any reporter walked into a training room, he would walk by a table this big lined with syringes. What did they think those were for the coaches? I mean, and when I went around with that book, every sports writer I had to do an interview with was furious. I mean, it was like I personally insulted him. And it's now 30 years later, and although I'm not close to sports anymore, every time I talk to guys, it sounds like it's the same. Dr. Huizinga's presentation is exactly what has to happen. The thing about the player has to take personal responsibility is very important, because the one bind that I find that a decent doctor gets caught in, who's a guy who's trying to help you, is he knows you need to be out there too. The pressure is just not on him. He knows that if you stay off that field too long, you're going to lose your job. And so I had a doctor in 1965 who secretly drained my knee and injected me with cortisone for 20 straight weeks. He had never put it in the records so that I could play. My right knee rotted away, but I got to play. And that was my idea. So there's plenty of guilt to go around everywhere in this business.
It gets very difficult. After I wrote my book, our team owner went to the trainer who had worked for 30 years and told him to go on TV and denounce me. He refused. He got fired. That's after 30 years of working there. Players, when they agreed to be interviewed in my book and have their stories told, were almost crying, saying, "You better go get him because I'm giving up a lot." There were 3 coaching jobs offered to players who were in my book. There were multiple other underhanded things. This is big money. People called me and were worried that I was going to get shot. This isn't kid stuff. You don't go out and mess with the networks and mess with the NFL and think that they're just going to sit by benignly. You can't go out and tell the truth. Players are scared. Coaches are scared. This is the big time.
But you have to look at how they morally and lay out that decision, because a lot of times it's laid out with the understanding that they are they're under the protection or under the payment of a team, so it colors the way they do it, or they don't fully. A lot of these guys didn't really understand the conflict of interest. I mean, Kurt Marsh, one of the things he said was he believed the team doctor was doing the right thing for him. What a scary thought that was, for him to have belief in a doctor or in the one thing with the teams that had put the health care services out for bid. One of the things the guys told me is, well, they would be steered to our hospital like any other managed care patient. So you go into that doctor and he says, okay, I want you to go over and use our x-rays, our internists, our this, our that, because, and the player doesn't know that this organization has paid $500,000 for the rights to the official health care provider. I mean, it's just a minefield.
A football player's life expectancy is somewhere between 55 and 61, which is why our life insurance policy, our league union life insurance policy runs out at 55. I would never let my son play football. I would let him play basketball, baseball, whatever he wants. In fact, I've got a book upstairs you love, because that's all it's about, is coaching kids at that age, where when you've gone through all that, and we played against Derek Jeter and the Maroons, and I watched Jeter make that jump. At the same time, my son was about ready to want to go on to college, and I'd done it, and I'd done it from the same town. He was living in the same bedroom I grew up in, and he was a better athlete. He was smarter at the game. He was all those things. And all I could say to him is basically what it's all boiling down to here is you have to make your own decision. Here's what happened to me. And eventually they get sick of hearing that. The last thing they want to hear is Dad. He refers to him as my nom stories. But I'll never forget, I took him we went to have dinner with Mike Ditka. And for some reason, Carter's been around famous guys all his life. Ditka is just this magnetic personality, and he treats kids great. So Carter was just mesmerized, and we're in Ditka's restaurant in Chicago, and Carter's just listening and as all these people are coming by paying homage. It was the year after they won the Super Bowl. And Mike is holding him off to talk to Carter, and he says, Carter, what sports do you play? And suddenly his hands magically appear from under the table. He goes, I'm a real good receiver in football. And he really was. He was a great receiver. This kid at 12 years old was catching balls thrown by a college quarterbacks 30, 60 yards down the field. He had tremendous hands. I wouldn't let him play. We fought every fall. And in a little town, that's all there was to do. And so Dick says, well, Carter, you really ought to think, a kid like you ought to think about golf and sports you can play, your tennis, sports you can play your whole life. And the look on his face went from pure admiration to total disgust. And he said, you're just like my father. And that's what you're dealing with kids.
It takes many people to work together to avoid complying with so many of society's rules. The illegal drug use, the one-sided practice of medicine, and apparent cover-ups of inadequacies in the medical situation in football confront sports management professionals with serious challenges. Dr. Huizinga suggested that team doctors get second opinions and recuse themselves from decisions in which their team loyalty may interfere with their medical judgment. Pete Gent was introduced to drugs in response to injuries sustained in sports. The ready availability of drugs and the widespread tolerance for their use by team owners, players, and doctors indicates several ethical and managerial issues remain. Armin Katayan illustrated how athletes who trust their teams for quality health care may suffer long term. He called these conflicts of interest among the owners and the physicians a minefield in which sports managers must tread. Team owners and team physicians have fundamentally different professional responsibilities, though they may share values regarding team success. Athletes who also share the desire for team as well as personal success may find themselves risking their long-term future health for short-term team success. Managing this conflict of values, rights, responsibilities, and consequences is one of the most important managerial challenges sports professionals face today.